So let's begin, with what I'm going to say with a little introduction. My name is Tamaan Osborne-Roberts. I'm a family physician here in Denver, Colorado. I work primarily with older adults and have worked the majority of my career taking care of communities, including our own community, that have had some challenges. Let's start with a little bit of honesty from my part. This is hard. Everything over the last year has been hard. Frankly, being a person of African ancestry here in the United States is hard. Which is why, in my opinion, so much of what is going on with COVID-19 seems unfair. Why is it, once again, our community that is at higher risk? Why is this being pushed towards us? Why does it seem like we are the people getting this and unfortunately the people passing on from it? Why us yet again? And I'd like to just validate that. It is hard. It's really difficult. But that doesn't change the reality that it is us getting it and it is us dying from it, and that there are very, very specific reasons for that. One of those reasons, very simply put, is stress. Being Black in America is stressful. Being Black in America over the past few years in particular has been stressful. And there has been much written for a very long time about how stress affects the immune system and breaks it down and makes it less able to fight diseases like COVID-19. Truthfully, I probably don't have to tell most of you that. Most of you can probably feel that in your bodies on a day-to-day basis throughout the majority of the years you've had. But this is one reason why our community is more vulnerable. We're also at higher risk secondary due to our nutrition. Many times, many of us live in places where we don't have access to the same healthful foods that many others in our country have. Even if we do, oftentimes we have a harder time accessing that for a whole range of reasons. That leads to another reason that we're oftentimes more susceptible, which is oftentimes caused by nutrition: diabetes. Our community simply has a higher rate of diabetes. It's part due to nutrition. Frankly, it's also likely due to the stress that we've endured over the many, many years. And there are other potential reasons as well. But diabetes is something that makes COVID-19 more severe if you contract it, and makes those of us who happen to have it more likely to get it. And frankly, our entire existences, our jobs and our family lives oftentimes put us at higher risk. Many times the jobs that we have been called upon to do take us out into close communion with other members of the community. And that is the nature of many of the jobs that many of us hold. And truthfully, communion with other members of our community is incredibly important to us, oftentimes from a cultural standpoint. We live together, we work together, we get together outside of work, we get together at church and at each other's homes and for meals. This has long been one of the ways we have endured and survived and occasionally thrived. It's one of the things we've learned over time. But all of that puts us at higher risk. Now, having said all of that, I realize that there are some people listening to this talk right now, even at the end of everything I've said, who are still asking themselves, do I really have to do this? Like Mr. Lewis said, maybe you haven't been sick before. Maybe you really just don't see the point, or maybe you're just fed up. This is yet another thing that you really, really are just tired. And again, it just seems unfair. Well, let me tell you a little bit about my own experience. At the beginning of March in 2020, very early on, right as we were realizing this was a pandemic, I came down with COVID-19. And after having it, and having it for 3 or 4 days and really starting to get better, as a healthy 43-year-old physician, I thought, okay, that wasn't so bad. That was until I went to cook bacon on morning 4 or 5. And having thought, oh, I didn't turn on the oven, must not be cooking, I went out to find the bacon completely cooked and myself completely unable to smell it. And after taking a bite, to taste it. No taste for coffee, no taste for chocolate. Honestly, if I'm being honest, no, couldn't even taste whiskey. It's frightening. That went on for 2 months, and I did not know if I'd get my sense of taste or smell back. But over time, it did start coming back. And I thought, okay, I might be done. But that was until the fatigue started. And I found myself unable to engage in physical activities that brought me joy and things that I had been able to do pretty easily just a couple of months before. And as that was going on, I began to develop digestive difficulties where I tried to swallow and I could feel the food stick right here. Half a minute, wouldn't go down. I'd swallow some water, try to get it to go down, still wouldn't go down. And eventually it would clear, but it left me wondering with every single meal, is this the time that my stomach finally stops working? 8 months after contracting COVID-19, the long haul symptoms that I was having finally cleared. 3 months, actually not even 3 months, 1 month after that, I had my first COVID-19 vaccination and my second vaccination a month after that. And I will tell you, between having had COVID-19 and the symptoms that it came with, and the mild flu-like symptoms I got after each of my COVID-19 vaccinations, hands down, no question, I would take the COVID-19 vaccination again over having had COVID-19. Thanks for listening.